Welcome to The Link. This week, the election week, elections have kicked off, but I know that elections are just a period and a season. In fact, they're disruptive in nature, so we need to speak about business continuously, because before and after elections, business will continue. So tonight we're discussing a report that is supposed to be released on Friday, done with Innovation Village and partners, and we have one of the partners in the studio today, and it talks about the future of retail. My guest tonight is Mr. Davis Musinguzi, who is the MD Rocket Health. Davis, welcome.
Thank you very much. Glad to be here.
I know you worked in collaboration with Innovation Village on this report. It's yet to be released, so we don't have all the findings. However, I want to give you some background, and we discuss some points that are useful for our viewers. First question, it says future of retail. What is retail?
Well, first of all, thank you everyone for joining us today. I'm Davis Musinguzi. I'm the managing director of Rocket Health, and we are a direct consumer healthcare company. So we're involved in the retail business, which is interacting directly with the consumers, selling them healthcare services. And really, what the future of retail tries to state is that there's a way things used to be, where you would walk into a physical store, exchange cash for services that you would consume as an individual. But we've seen that that relationship with retail is starting to change, and retail is becoming more digital. The consumer is getting much farther removed from the actual service provider physical encounter, and everything is now happening over all kinds of platforms through all kinds of intermediaries. And I think this report basically highlights that change, so that retailers can make that adjustment.
Okay, you didn't answer my question on what retail is. We can go back a little bit so that the viewers are with us.
So, what retail basically means is that there's a service provider who is offering a service or a product directly to a consumer, and they have a one-on-one interaction, and normally they're exchanging money, physical cash or digital cash, to be able to receive a benefit of a product or a service. And this happens every day, even as you walk into any shop, right? That really is a retail
supermarket,
service, a supermarket, when you walk into a restaurant, really all that can be determined and defined as retail. Okay,
well said. When we discuss future of retail, it seems that all fingers are pointing to digital. Is digital the singular definition of future of retail? What's your take?
I think the largest transformation that we're going to see is going to be driven by digital technologies. Because what digital really does is that it makes it more affordable for people to access, meaning that anybody that has a mobile phone can be able to access retail services. It also makes it, it democratizes it in the sense that every merchant that can now participate in a retail experience with consumers, which previously didn't happen before. And then also another interesting thing, it makes it much more scalable. So you're able to reach more consumers than you were ever going to reach by having a single store around the corner in your local town. So what digital really does is it makes it a much more scalable experience for the service provider.
Okay. Davis, digitalization includes devices, especially the phone. And yet we know that, for example, the smartphone that is adaptable here in Uganda is not as widely owned yet. People still have the capability. Can those also come and play into the digital space for companies which are expanding, digitalizing? What can they do about the other possible clients, but they're not having smartphones?
Well, digitization is really a journey that the consumer and the merchant in this case, or even the platform that is making that interaction possible, has to go through. Like you've already mentioned, some of it involves hardware, some of it involves software, some of it involves other collaborations with, let's say, telecom companies to facilitate mobile money exchanges. So there are like multiple players, and it really is a journey for all of these entities that are involved. So right now, a lot of digitization has been able to happen at even the most basic level, whether it's through USSD. I mean, a lot of people currently transact mobile money via USSD, and that just needs a basic phone and not even a smartphone. Which
Star
means,
blah blah hash.
Yeah, exactly, and that is done. Or you go and find a Momo number for a service that you have found on Instagram, or a product you found on Instagram, and you just make the payment, and somebody puts your product on a bike, and it eventually gets to you. Okay. The person also receiving the money on the other end may just have a basic phone with a simple Instagram account, and that's all that really is. So there are real opportunities for kind of low capital entry into a digitization process for a lot of consumers and merchants.
You said right, because earlier we were discussing and say digitalization is not necessarily cheap.
Yeah, it may not necessarily be cheap, because there is work that has to go into the mindset of the consumer and the mindset of the merchant. People now need to establish new trust that when I send you money digitally, that I'm going to receive the product or the services with a third-party motorbike logistics partner. I'll have never met the provider of the service. I don't even know where they're physically located. So there's a mental leap for consumers in that sense.
Trust.
So trust is a really big component of that. And yeah, there are other investments that may need to be made. For instance, when you look around internet connectivity, that means everybody, wherever they are located, needs to have a good stable internet connection or mobile network access. And then also, when you think about the expense that goes into logistics, it means you have to have motorbikes in multiple places around the city to be able to get to everybody in a very kind of efficient turnaround time. Okay. So there is an investment that goes into digitizing the future of healthcare, that not just healthcare but also retail, that everybody needs to be aware of.
Just so consumers understand this, and we're not conceptual here, tell us the experience of Rocket Health. How have you digitalized so we get it?
Yeah. So what we have done at Rocket Health is that we have made it very easy for healthcare consumers to be able to access services. So right now you can be able to just call in and have a voice or chat or video call consultation with a medical doctor. You can also have your medicines delivered to you wherever you are, and if you need a lab test done, we can have a technician come to your location and pick up your sample and run the tests, and the doctors call you back to explain your results. And if you need a physical examination, you can get that done within our clinic. What is really interesting about that service delivery model is that you can buy all of this online. So if you go to an online website, rockethealth.shop, you can book your clinic visit, you can book your vaccination at home, you can pick your parents' medicines from our online pharmacy, you can do a wellness lab test, you can just select the test, and you can pay for it via mobile money, you can pay for it via your debit or credit card, or you can pay for it cash on delivery, and all these services will come to you at home. So really that has trying to transform the retail experience in healthcare, because as far as everyone knew, healthcare used to be riddled with all these kind of long queues and waiting rooms, and you have to go to a physical location, and you have to wait for the doctor to be available, and even then you have to go to the lab, the pharmacy, and it can easily cost you 4 to 6 hours a day, right?
Yeah,
Easily,
the whole day
right?
sometimes. Yeah.
And now you can just sit at home and through this online e-shop experience, get all the healthcare services that you need right where you are. So that's been our experience so far, and we've seen a huge growth in the number of consumers relying on that through this lockdown period, and even as COVID continues to spread within our communities. But we've also started to see that if a consumer uses it at least once, they're not going back to the way it used to be. And I think really that's what this report is about. It's telling you that we're starting to see what the future really looks like. We're trying to see that conversion to the future. People are now switching to the future.
Okay, very well said. The report also talks about, Davis, gig economy. Yeah. That sounds like gig, actually. What is this gig economy, and who can play there?
Well, if you've hustled in and around this city, you probably may know what a gig is, right? It's normally a small, short-term job with defined side hustle, with a very kind of clear transaction where if I do this, I will get this, and I'll just need to wait for the next time I'm asked to do that same thing. And we see it all the time within digitizing of retail. So a lot of people that participate in the gig economy may be, kitchens that are operating at physical locations you may not even know about, and they're receiving your orders for food, and they're giving that food order to another gig participant who would be the motorbike rider who will actually get it delivered to you. And there's also possibly another gig in there for whoever is processing those payments per transaction. And, somebody's making a platform available for all of these people to participate in this gig economy. For instance, in our case, we're building out our gig economy around, let's say, our pharmacy services. So we'll receive an order for a pharmacy product, right? We'll have a gig participant prepare that prescription, so it would be a pharmacy technician. You'd also have another person trained, a pharmacy assistant, have these medicines delivered to you wherever you are. So right there, you've kind of just built a pipeline of a gig economy within the healthcare space, and the same can happen for lab services. And we're looking to eventually add, thousands of lab technicians to participate in that healthcare gig economy, where they can pick up your samples, bring that into our lab. You can also have doctors work a gig where they explain these results to you, and have it all work out in this entire gig economy.
Thank you very much, Davis. Our time is not enough to break down these issues, but we have tried. The report is going to be released on Friday, and Rocket Health and the Innovation Hub, Innovation Village in Ntinda are working together to shine a torch in where SMEs must go. And if you're an SME, time for change has come. And for all of us, we can benefit from the gigs that come from digitalization by SMEs. Thank you for joining us tonight. That was The Link.